We undertook this journey because we were aware of the extraordinary richness of patient conversations on the internet. So literally millions and millions of patients speaking out on any number of issues, from drug medications to their experience of care in the hospital and healthcare setting. So we had a hypothesis. We felt that by digging into these conversations, by looking at them, and specifically in the context of two healthcare organizations in Ontario, we felt that we might be able to anonymize these conversations, make sense of them, and better understand quality improvement priorities at these two organizations and for Ontario and for the world. The Change Foundation is a premier organization in terms of really understanding quality improvement, where it's been, what it means, and where it's going in the future. The Health Strategy Innovation Cell comes as an expert institution in understanding and organizing online intelligence. And so we felt by marrying the two organizations, we could bring forces together and really better understand online intelligence as it applies to quality improvement in healthcare. What we have found is that healthcare is using social media for a variety of purposes, but very little for quality improvement in its traditional sense. So healthcare organizations are using social media to advance charitable initiatives, to push out research to stakeholder groups, to collaborate on efforts internally. But we found that there's been a real hesitation, or let's just say early stage trepidation to dip into the waters of quality improvement as we specifically understand it. That being said, there are some organizations in the United States that are making more headway, and we reveal those organizations in our E-TOOLKIT, which we have online. But I think the biggest learning is that healthcare organizations generally realize that the social web, the internet, as we understand it, which is increasingly social in all respects, is an enormously powerful tool to empower consumers, to empower individuals within healthcare organizations. But they're just thinking about how to use these tools to speed up the quality improvement cycle. So to actually take data from the internet, take learnings from what patients talk about online, and to actually build it into the quality improvement cycle. So they're thinking about it, they're strategizing about it, and they want to get their head around how to do it right and ethically. And we hope that this E-TOOLKIT and our learnings throughout this project can help them and nudge them in that direction, and also enable them to talk to one another and to collaborate and think about emerging best practices in this field. They are very legitimate concerns, and we've heard that throughout the course of the project and also in speaking to healthcare providers on this topic across Canada. But what we've learned is that the concept of privacy and the term privacy predates the social web. So if we think of the social web as really taking off around 2003, 2004, the concept of privacy in law and in ethics really predates that. Whereas with the social web, we feel that a more tangible, more meaningful term to really get our head around is data control. And data privacy, and what the Privacy Commissioner in Ontario calls privacy pragmatism. And these terms are more valuable to us because they make us understand that what we used to understand as privacy is better understood in the context of this social web as data control, and there's a spectrum of people's comfort level with data control. And so we have to recognize that people have data about them out on the internet, and these data can be mined, and they are being mined by various organizations. The issue that people have to understand, and organizations have to understand, is how can we best ensure very rigid best practices data control stipulations. And these are emerging rules that we're just beginning to understand. And again, we hope that our E-TOOLKIT has advanced this conversation. On all of these fronts, I think that the social media is absolutely in the spirit of the Excellent Care for All Act legislation in Ontario and similar quality legislation emerging around the world. If we look at patient engagement, for example, and the understanding of creating a patient declaration of values, in order to do that in a real-time way, it can be very beneficial, as we've learned in the course of this project, to really tap the pulse of what patients are saying about what they want and what they need at any given moment in time. And these can then generate generate in real time insights for healthcare organizations in terms of a declaration of values that can be evolving and not static in time. In terms of accountability, again, the social web enables openness, transparency, which is really in sync with the entire concept of accountability. In terms of input, engagement into the quality improvement cycle, again, the social web enables us to listen to those conversations in an ethical, anonymized way and to make sense of these conversations in order to prioritize quality improvement initiatives for a healthcare organization or for the system at large. We hope Ontario will take up this learning by engaging in a dialogue, in a conversation. So this e-toolkit, this quality improvement e-toolkit, lives and breathes online, and healthcare organizations and members of those healthcare organizations and members of the public can contribute to the debate by blogging, commenting on the content, by looking at our e-directory of healthcare organizations that are using social media, can contribute to how these organizations can use social media for quality improvement purposes. So we hope that the system will also pay attention to this dialogue, to the e-toolkit, in order to better craft public policy around issues such as ethics and transparency in the use of the social web and healthcare conversations around the social web. In terms of what's coming next, I think Health 2.0 is emerging to really what Tim Berners-Lee and others, Tim Berners-Lee, the inventor of the World Wide Web, referred to as Health 3.0. And that's really what technologists refer to as the semantic organization of knowledge. So that we have now all these 2.0 engagement tools, but I think we're moving to a stage where we have all these 2.0 engagement tools, but we also have a wealth of rich, real-time information that can be elegantly organized, elegantly understood, and synthesized. And ultimately, very quickly, I think, healthcare organizations and the system at large is going to be in a position to really make sense of these conversations in order to prioritize, set issues, and in particular, set quality improvement priorities.